Hey, practice owners. We are back with another edition of Coming Back Stronger. And this, I think you'll be very interested in it. Our guest is Tanya Dunlap from Perio Protect. And how you doing, Tanya?
Good to see you, Steve.
Quarantined in St. Louis.
That's right.
Yeah, it's unfortunately it's not. I hate to say this. I'm supposed to be in Hawaii right now.
Oh,
So I'm unhappy on a lot of levels, but thrilled to see you.
it's good to see you too.
We were talking earlier about what you do, what Perio Protect does, and for dentists who 86% of own their own practice. They have right now they're neck deep in EIDL loans and PPP loans and projecting cash flows and all this junk that is a million miles out of their comfort zone.
Right.
And what I wanted to do with you is help give them some things that bring them back, but also combine it with the ability to forward focus or future focus on their practice and come back stronger.
Right.
So this is probably more clinical than if somebody's binge watching these, which apparently we have a lot of people who, because on the back end we can see they watch one, then the next one, then the next one, the next one. So we want to keep them coming. But this is a lot more clinical, which I think will make a lot of dentists / practice owners who are watching this happier. So thrilled to get that started. So if you could just take a quick minute, tell us who you are, who Perio Protect is, a little bit about how you got where you are, and then I'd like to dive into I know you've got some slides and a lot of numbers, so
Right, terrific.
dive right into that.
So my name is Tanya Dunlap. I'm the managing director at Perio Protect. We've been around since 2005 with an adjunctive home care treatment to manage bacterial infections that are associated primarily with periodontal disease. Mm-hmm. And what I have to share with you guys today, once you figured out solvency, once you've done all your inventory for PPE, once you know when you're going to open, a couple of really practical options for you for opening. And I'm going to share my slide here. Mm-hmm. What we want to do is to improve health and solve problems. And the first problem we can't avoid, right, is the new virus.
Right.
So we have to figure out a way to live with this. We have to figure out a way to get back to the business of dentistry because this is not going away. We're not going to have a vaccine likely for months. We don't have a treatment yet. We got to figure out what to do. So ADA has got some guidelines out there, and you can find this on their website. The first thing that they want people to do is to be thinking about a pre-treatment rinse, and they're recommending a 1.5% hydrogen peroxide rinse. It looks like, I'm going to call this SARS-2, the novel virus here that causes COVID-19. The SARS-2 appears to be vulnerable to oxidation. Hydrogen peroxide has two therapeutic effects, oxidation and oxygenation, both of which Perio Protect harnesses. But you can see the reference there that's in blue, 321-27517. Okay, so what that is an article. And this is the research article that you can pull up. It basically says, chlorhexidine may not be effective to kill this new novel coronavirus, but because the virus is vulnerable to oxidation, and they're saying it is vulnerable to oxidation, that they believe a 1% hydrogen peroxide or 2% povidone would be recommended for the purposes of reducing the salivary load of oral microbes, but also these viruses. And what we're seeing with the new virus is that the saliva is teeming with virus. If you want this reference, here it is. And you can also just link right to the website at the ADA and you'll find out. Okay, I want to specify and be really clear. We're dealing with very few data sets. So I used to be the research liaison for Perio Protect and all the independent researchers. We have such little data here to work with. But this is interesting. Oral transmission of this virus is serious. And you want to protect your team and you want to protect your patients. In order to reduce the risk of oral transmission of the virus, hydrogen peroxide is a really nice option. But let's just look at maybe why this is such a big deal. In the original SARS virus from 2002, 2003, they've had a lot of time to study it. And they've used animal models. They've used mice and hamsters and ferrets and cats and non-human primates. And the virus doesn't cause this lethal lung problem that it does in humans, except for in the rheus monkeys. And what they did was they injected the virus in the nasal passages of the monkeys, and these monkeys came down with it. But what they found is that it's the epithelial cells lining the salivary gland ducts that are the early targets. And I don't know, Steve, did you pay attention? Did you see recently that saliva testing just was validated?
Yeah.
So out of Rutgers, we've been using this saliva test for a while. It was a sputum saliva test for a few weeks, but I'm really glad to see it because the viral counts in the saliva are huge. I mean, they're ridiculous. So it could be that this is one way that the virus actually gets its foothold in the body, right? Through your saliva glands. EPA doesn't make drug claims. They do they do make disinfecting claims. And against this new novel virus, SARS-2 is what I'm calling it, just to be easy and short, hydrogen peroxide is effective. These are on surfaces, for example, with a 5-minute exposure. Okay, when you rinse with hydrogen peroxide, it has a burst effect. All of that oxidization is going to happen in a big burst. It's going to be gone. It's going to be into hydrogen peroxide is going to break down into oxygen and water in just under 2 minutes, we would expect with a rinse. Okay. What Perioprotect harnesses as a primary antimicrobial agent for the treatment of periodontal disease is a 1.7% concentration of hydrogen peroxide in a gel form. The gel is thick, it's gooey. You put it, the way we administer it is in the bottom of a very specialized tray. And then if you flip it over, it doesn't go anywhere. It's gooey, it's really thick. So right now, it is really hard to find hydrogen peroxide rinses. If you don't have a great supply, it's gonna be hard for you to keep this on hand. You could buy Perio gel if you want it. We've got thousands of tubes currently. And what you would do is you'd put it on a toothbrush and brush all over the mouth. You'd have it on your patient. Your team could do this too, right? Because your team might be doing peroxide rinses also. If you think you've come into contact with somebody, why not rinse your mouth if it's oral transmission this way? Brush your teeth. Brush your palate, brush your gums, brush your tongue with this gel, this hydrogen peroxide gel. It's going to mix with your saliva a little bit, gargle with it, get it in your mouth, coat it as much as you can. The benefit of using a gel is you're going to have really comprehensive coverage. You're going to get better coverage, meaning it's going to stick on there longer because it's gooey, and it's easy to do. So spit it out when you have to spit it out. You want to keep it in your mouth as long as possible. Spit it and don't rinse. It's one way to be reducing the risk of oral transmission. Okay, so that's the first thing I want to just mention. Hydrogen peroxide rinses are highly recommended. The second problem is delayed patient care. This is a true problem. You've been closed for weeks. Some of us are going to be closed for months. You have a backlog of patients. If they're perio patients, if they have gingivitis, they're going to be in worse situations than you would recommend. And not only because they've had delayed care, but because they're stressed out, they're not eating well. I mean, all these other things. So what are you going to do for patients? And when you're talking about hygiene procedures, the big problem is aerosols, right? This is one of the primary ways, I mean, that we believe, nobody actually has good data on this, but we believe the virus is transmitted through saliva droplets, through sneezing, through these aerosols. Well, you haven't had anybody through. Even if patients all came back in a rush, you still wouldn't be able to get them through your office quickly. And then when you did, we expect that it's going to take you a little longer. You're going to space your patients out. You're going to do more disinfecting procedures. You've got more PPE. You've got additional protocols in place to keep your office sanitize, keep patients safe, keep your team safe. One of the things you can do while patients are waiting to get into the schedule is prescribe Perio trays. So a Perio tray is a very comfortable tray. I'm looking around to see if I have one near me. It's a super comfortable tray that has a special internal peripheral seal and extension. The seal and extension, they work like a gasket. And it's really nice because you get these bacterial infections that are deep below the gums. Toothbrush, rinse, and floss can't get deep enough. So between your office visits, every 3 months your patients come in for maintenance. Between these visits, there's no way a patient can keep this clean. When you prescribe a Perio tray, it will reliably deliver this medication, and it's really gentle, it's easy to wear, deep below the gum so the medication can fight the infection. There's 2 protocols, and the one that I'm going to recommend today is the one that is seriously underused. The protocol that's used all the time is in maintenance. Your patient goes through initial therapy, people prescribe perio trays, you wear the perio trays. Not only do you give you better results, you build on what you got in initial therapy, and better results meaning reducing bleeding, reducing inflammation, reducing pocket depths, but you can maintain these gains and keep patients really healthy for years. That's how it's usually used. But another completely legitimate and very innovative way to use Perio Protect is before debridement and scaling. And again, even before debridement and scaling, this chemical therapy, this oxygenate, so hydrogen peroxide is doing two things. It's killing the bacteria and it's releasing oxygen. And this is really key. The deeper you get into a pocket, as you release oxygen, you change the microenvironment of the periodontal pocket. The hydrogen peroxide is going to kill bacteria. It's broad spectrum. It's going to kill all kinds of bacteria. When you take the tray out of your mouth, the bacteria repopulate. But now they're in an oxygen-richer environment. So the kinds of bacteria that repopulate are healthy bacteria at the expense of the pathogens. And anybody who wants this information, we've got a recorded webinar. We are happy to have you become a Perioprotect provider. You just watch this webinar. It's going to give you in great detail, give you an outline for it. It'll be easy. Let me just show you what happens. I just have a few before and after images here to show you what happens if you use tray therapy first. And controlled clinical trials confirm the benefits, and I'll go over that too. But if you use trays even before you do debridement or scaling, you can have significant benefit. The protocol calls for it before and then after. So this is 2 weeks of perio tray delivery of medication only. Again, the primary antimicrobial is hydrogen peroxide. This particular patient has Parkinson's disease. Don't know how long a patient with Parkinson's can sit in your office, keep their mouth open. So the treating dentist, Rebecca Hobbs, prescribed trays. This is 2 weeks of tray therapy only. And honestly, this particular patient his Parkinson's was bad enough, he needed a caregiver to put the gel on the tray. And you just stick the gel on the bottom, the occlusal surface of the tray. This is a patient with uncontrolled diabetes who's had a heart attack. This is 1 month of tray therapy first. And this kind of protocol is excellent for those patients who have chronic systemic inflammatory conditions like type 2 diabetes. Look at that tissue. This is just a month of tray therapy. A month of tray therapy. Those were all the same patient. Mm-hmm. Different patient. This is trays with debridement, so you wouldn't have any aerosols here. Trays with debridement. Obviously, it's going to get better if you scale. Mm-hmm. It just, the benefit of using trays first. Okay, so first, we are going to reduce some of the bacterial loads. We should be able to reduce some of the, so if you have a patient with trays, have them wear their trays in the chair, right? You just stick more gel in there, it's going to ooze out, and usually you just need a small amount. Load that thing up with the gel, stick it in your mouth, let the gel ooze out. It's going to come up over your gums, and then you'll swish around whatever's left. Leave it in there as long as you can, spit it out. But normally people wear these trays 10 to 15 minutes at a time. Okay. Use that first. It's going to reduce the reason for using trays first. It reduces the bacterial load, it reduces the infection, it reduces the inflammation, it reduces bleeding. You even get some reduction in pocket depths. It also makes the hygienist's job easier. When you're not working with tissue that's bleeding all over the place, you can see better, and your job is just easier. This is perio trays first, then debridement, then more trays. This is before scaling, everybody. 3 weeks of trays, then debridement, then another week of trays.
That's it. Yeah, those are incredible.
These are perio trays added to maintenance. Huh. Perio trays added to maintenance. So, I mean, we don't even have to be clinically trained to see the difference here. So I just want to encourage people that the results last a long time, but you do keep this up. You just keep wearing trays every day, 10 to 15 minutes. This is a 5-year study that went out for periodontal patients who had exhausted their treatment options, surgery. Some of them had multiple surgeries. We got a handful in here. There's 66 patients in this study. Got a handful that don't have enough bone for surgery anymore. And they go on the tray therapy with just hydrogen peroxide twice a day. They start out twice a day. And then later on, half of them drop down to once a day. There's no statistically significant difference between the once a day and twice a day users. But that drop between pre-treatment and 6 months, that's a 75% reduction in bleeding on probing. We're not talking about a gingival stroke. We're talking probing to the base of the pocket. You see how it flatlines? Mm-hmm. you're able to maintain your gains for up to 5 years. Tray therapy works equally well for smokers and non-smokers. In that particular study, we had one smoker that didn't do well, but there's also 2 6-month controlled clinical trials where smokers did equally as well as non-smokers. And whether we're talking about shallow pockets or deep pockets, this is one of the controlled clinical trials. Patients wore trays first before scaling. I just want to give you some clinical data to support this protocol. This vertical line, can you see my cursor, Steve?
Yes. Yeah.
Okay. This vertical line is when scaling was done. So all scaling was done at week 3. Your control group is red, the group wearing trays is blue. Everybody's using the same toothpaste, same toothbrush, and you can just see huge reductions in bleeding. Everybody does a little bit after scaling. That's shallow pockets, and this is deep pockets. Your blue group's what you're watching. That's a big drop in 2 weeks of tray therapy first. This is what the tray looks like in the mouth. How this is different than any other tray is there's an internal peripheral seal for every tooth. Typically, we make it with a probing chart. Now, in this COVID-19 world, we can make a uniform seal for you. You just tell us if they're gingivitis, maintenance, or periodontitis, we'll give you a uniform seal. It fits really precisely. And this seal and the extension beyond it prevent the medication from leaking out, and it works like a gasket. When we make the seals customized for every single tooth, we expect trays and maintenance to last about 5 years. If you are willing to probe and give us a fresh probing chart right now in a Corona-19 world, we'll make it that way. But if you want just to have a uniform seal and you don't want to get a fresh probing chart right now, which we understand, we'll give you a uniform seal. It's really important that you consider this not just now, but in the future. Half of American adults over the age of 30 have chronic periodontitis. They're bleeding like crazy. Antibiotics aren't going to do it for us. We're in a post-antibiotic age, according to the director of the CDC. And there are so many bacteria that are now resistant to antibiotics. And every 11 seconds, somebody in the United States gets infected with one of these AR bacteria, and it's killing people every 15 minutes. Frankly, if antibiotics were going to work, they would have worked already. So I'm just encouraging people to think about hydrogen peroxide, both for its antibacterial, anti-inflammatory purposes for the treatment of perio. And let's talk about this now, because all of a sudden people are more aware of what an inflammatory burden is and how strong your immune system needs to be. If you have chronic periodontitis, chronic infection, it's a chronic burden on your immune system. The best way to handle any challenge to your immune system, bacterial or viral, is to have a healthy immune system.
So how, let me ask this, and I'm making, I've got notes on top of notes here.
Okay.
So for somebody who's watching that is 2 things, I guess, knows enough to be dangerous, but
Right.
wants to know more. You have a lot of materials, I know, on the clinical side.
We do.
And that's one of the things I think that sets Perio Protect apart is your commitment to the clinical piece of this. I mean, you guys really maybe, pioneered the whole study that resulted in trays. And I know your dad specifically was, like very critical for people who don't know. I mean, he is the sort of the godfather of perio treatment in a general dental office.
Yeah, we created this sector in dentistry with tray therapy for perio. It is it. Yeah.
And so you've got the knowledge, and that's something. First of all, we'll put a link in here, but they can go to Perioprotectcom, and I know.
I would recommend providers with an S on the end of that, providers.perioprotect.com. There are resources in there so you can look up the published studies. If you want to get the controlled clinical trials, a lot of the reprints are right there. You just click on a button, you'll have it right in front of you. If you have any questions, you can always talk to me. I'm happy to have you put my email up. Any of your viewers who want to become a Periprotect provider or just want more information, we're making it free now. We have an 1.5-hour webinar that goes really deep into the science, more on the perio side, less on COVID, because I just want to be clear here. There's really very scant data on this COVID virus. But I know that people are having a hard time finding hydrogen peroxide rinses.
Mm-hmm. And that really, Tanya, is my second, sort of the second point or second question or second thing to explore is the COVID side or the coronavirus side. And only in that patient awareness of things. I mean, I've heard the word dental or the term dental aerosols more in,
Right.
conversation than 20 years.
Right.
I mean, but that's in the industry. But where you're hearing it is, CNN and Fox News, and just Google it, and all the things that your patients are going to expect going forward. Their awareness to things like dental aerosols are high. Their awareness to how you treat inflammation, how you treat viral transmissions, how you treat everything is going to be different. Call it, post COVID-19 versus pre-COVID-19. Your patients didn't care, a small portion of, let's rephrase that, a small portion did, but most patients came in, wanted their hygiene, knew that every 3 years they're going to get, crown, their kids are going to get braces, and we just move on. That's going to change. That in the post-corona world, dentistry is one of the few businesses where you touch your customer. All kinds of things happen there. So, so patients, I guess my point is, there are a lot of times where patients or customers aren't going to give it a second thought if you go play golf. But when you go to a restaurant and I've even heard you touch the menu. I've heard that. I read an article the other day about, these sort of people looking forward, that in the restaurant business, digital menus that are, wiped down between each customer. You're not going to have a menu that 28 people have held today.
Might be on a wall.
Oh, on a wall. And it's not a viral thing as much as it is just we have a heightened awareness of what could happen. So those things are coming. But in a dental office specifically, where you're touching, where bodily fluids are all over the place, aerosols are all over the place, you've just got to deal with that. And out of that, I think, comes an awareness of inflammation, of the health benefits of it. So maybe my question is, if you know that's coming, you're coming back, you want to be smarter and better, you want to address your new patient expectations. We don't know specifically what they'll be, but in general, it's going to be more dentistry and more how your healthcare and your dentistry are combined. What's somebody, maybe some thoughts or ideas on presenting the idea of Perio Protect trays to a patient who is clearly aware and conscious of the health concerns in the operatory?
Yeah.
Does that make sense? Is that a good way to ask that?
It is, yeah. So, I mean, if we talk about the virus itself, I would recommend that you guys send a letter out to your office or to your patients telling them all the steps you're taking to make sure that the environment is clean and safe for them. And frankly, universal precautions in general, I think dentistry does a great job. Right? I think in general, dentistry does a really good job of keeping patients safe. When you think about it in general, right? There's viruses out there we don't even know about. So putting a list or some kind of a video, I've got several colleagues who from the Next Level Practice community who are putting videos out talking about how they're making it safe and sending those to their patients or putting them on their website, easing some concerns. I would recommend that you do a hydrogen peroxide rinse or brush your teeth with peroxide or whatever it is you're going to do, and tell patients why. Right? It says the early data shows that this virus is really susceptible to hydrogen peroxide.
Okay.
We're going to ask you to rinse with it, or we're going to ask you to brush with it, and keep it in your mouth as long as you can. You'll spit it out when you can't keep it in there anymore, and don't rinse with water. And then we're going to come in, because it makes, and honestly, what you guys are doing is you're making it safer for your team also, right? This is what we're concerned about too. But when it comes to perio and inflammation, people who are now aware of inflammation, right? Especially if you can take pictures, you got intraoral pictures of what their mouth looks like when it's bleeding. You may not want to do that right now, but if you've got any of the past, talk to them about gum disease. While it doesn't hurt, it could still be hurting your body. It's taxing your immune system, so that if your immune system is like a battery, the more things you got plugged into it, the faster it's going to wear down. You want to keep your immune system as strong as possible. And treating the gum disease is important. Like never before, it's important.
And you have a lot of that science again at providers.perioprotect.com
We do.
on
There's a,
the
yeah.
impact of to the immune system.
Well, not so much that in picture form. Most of our like social media pics and videos and things like that we talk some about the immune system. That's true, but a lot of it is how easy it is, how comfortable it is, how much less bleeding you have, how much whiter your teeth get, because this is everyday use of peroxide. In like 5 weeks, you get super white teeth. Like I drink a lot of coffee and red wine, and my teeth are pretty white.
There you go.
How fresh your breath is, right? That's a lot of the videos are like that. But we are coming out with some new material, and anybody who decides they want to be a Perioprotect provider, then we send out a welcome box in the mail. We send welcome emails. We've got starter kits for you to help explain it to patients. We've got all kinds of materials set up.
I guess maybe the crux of my question is that merging of healthcare and dentistry.
Yeah.
And even with the practice owner, with the dentist, who sees it as dentistry. You come in and we clean your teeth. We'll put in an occasional filling. We'll do a crown once in a while, but so they can perpetuate that or change that with their patients.
Right.
So they're seen more as you're on the front line of healthcare. I mean, if you have coronavirus and you're digging in somebody's mouth, that's ground zero for it.
Yeah, we used to talk a lot about the relationships, the systemic relationships before coronavirus. I mean, I feel like that's all we're talking about now, but before coronavirus, we used to talk a lot about the relationships between inflammation in your gums, infections in your gums, the bacteremia that gets into your bloodstream during scaling, or eating an apple when you have serious gum disease, right? That relationship, and also type 2 diabetes, heart disease. But there's just so many. Any kind of chronic inflammatory condition. We talk about dementia. We talk about ED. We talk about pregnancy. We talk about some cancers, right? And the thing is you don't want to scare people. You don't want them to. You don't want to tell people that this is going to cause it. But there is an association, and your patients deserve to hear about that. Yeah. It's just hard to explain it in simple language, right? That's what we try to do.
And they come in wanting to talk about it more and more. I mean, you and I are both involved in some communities where docs have turned their practice into they call it a complete health dentistry.
That's right.
Just the idea of it. So they're not pushing it on their patients. They're attracting patients who aren't just there for some dental care and, a couple cleanings a year. They're coming in to say, listen, I know a lot's going on here. I read about it online. Wherever they saw it or heard it. But their awareness is much higher. So it's a really good time. So, and there's a percentage of people who have perio disease and are pretty much unaware. Do you know that percentage off the top of your head?
I don't know what percentage is unaware, but the CDC estimates that 50%, 47.6 or something % of adults over the age of 30 have chronic periodontitis.
Okay.
And you throw gingivitis in there, it's way over 80% of Americans. Most people don't know it. It doesn't hurt. It doesn't hurt them. It's not something they're concerned about on an everyday basis. But we need to be. There's no reason this infection should be left unchecked, untreated.
Right. Well, you become a proactive health provider as opposed to a reactive health provider.
And I would say 2 things we can learn from that complete health community that everybody can learn from them is the proactive part, right? And also the extra attention that you pay to your health histories and tying what you learn about the patient from their health history. And I don't mean just looking it over and checking the boxes that are checked or not checked, because I'm telling you right now, I know as my own, and I'm fairly careful when I fill those out. I'm not spending a lot of time on this. I'm just filling it out, right? But talking to people like, are you taking any medication? Have your medications changed? And then they say, oh yeah, I forgot to tell you about that, right? But really paying attention and tying their general health into what the services you are providing, because the services you're providing are key, really, really important. I didn't show a study here, but we've got one study, comes from Tim Pronger. He's a dentist. He's retired recently. He had an uncontrolled diabetic come in who had a heart attack a few years ago, and he extracted a tooth that was blown out, and he treated the gums just with Perioprotect first, and his HbA1c dropped more than 3 points. That is huge.
Yeah.
And then we watched it for a little while before Doc sold his practice, and the hemoglobin A1c, which is a long-term indicator of blood sugar, that stayed low out for like 18 months. This is something to celebrate that we
Right.
never really get to see. Yeah.
And it's a dental procedure, or it's founded in a dental office. And so I guess that's really the observation, or in the concept of coming back stronger. If you come back and see yourself as a dentist, flip on a switch and go back to what you're doing, you know, my belief is your patients have changed. Their awarenesses and their expectations have changed. And if you're not appealing to those, then, you know, they might move down the street. And I think it comes down to the physical appearance of your office. You know, you've got a lot of papers out on the counters, and you've got, you know, you have things that suddenly now are collectors for dental aerosols that 6 months ago, you know, nobody even would have noticed. Well, now they notice. And when they are, if you're speaking that new language and saying, well, let me look at these things, exactly like you said, you're talking to them in a way that they're going to expect coming forward. And I've seen some of these practices double in size. In in fact, there's one that I was just thinking of it when you said that. They're in a little tiny town in Ohio and doubled their practice size, just expanding into what they call complete healthcare, which complete health dentistry, which is things like perio treatment that are above and beyond. So it's not that you have to, you know, I think what I'm saying is the demand is there and will be greater post COVID-19 as opposed to pre. So if you want to spend time on something, learn that, start to integrate that into your thinking and your belief system and your practice, the way it looks and the way you practice and the way your team talks. And suddenly you're speaking in a way that your patients already want to hear. They just don't know it yet.
And one good way to begin to think about that is as you want to implement this, you want to change your standards here, is to create a standard of health in your practice. Your patients don't know what's healthy, right? They just know what hurts and doesn't hurt, if their teeth are white, if their breath is fresh. This is the stuff they know. They don't know what's healthy. You create a standard of health in your practice. You can do it with like a healthy mouth baseline. That's something Gary Cady does. You could do the Periprotect standard of health is, if you're bleeding at 10 or more sites in your mouth, and your patients have been through therapy or they've been a patient of record for a long time, and you consistently have 10 or more sites of bleeding, you should start talking to your patients about Perioprotect and tell them why. It's not normal for your gums to bleed.
Right.
These are infections. If your fingers were bleeding all the way around the cuticle, your patients wouldn't let that go. They wouldn't swallow it like they're doing in their mouth, right? I mean, we don't do that.
Yeah, and that is in the sort of the concept of coming back stronger. It's a mindset, and the docs who, you know, just want to stay where they are and kind of drill, fill, and bill are going to, I think, struggle coming back. I think there's a large percentage of the population that has a whole new understanding of barrier and protection. Think of our language. Our language has changed in 6 weeks. And like I said,
we never talked about cytokine storms till 3 or 4 weeks ago.
Yeah. And we, you know, so suddenly we're experts. And at the end of the day, those are the people who are your patients / customers and spending money, keeping your practice alive or going to a practice down the street. So I'm a big believer in proactive dental care and healthcare. And certainly it is a thing that is that has sort of gained a lot of steam in the last few years. I think this is going to be a place where I think it's really good for your company. I think this is really going to explode post-corona.
What we are after, Steve, really is helping dental teams get confidence that they can treat. I mean, perio, a lot of docs think of it as a black hole, right? They don't even want to deal with it. They just relegate it to the hygiene department, because what are you going to do with it, right? They come in every 3 months, you do something, but get confidence. You can get better results. You can keep those results long-term. It doesn't hurt your patient. I mean, some people still have to have surgery. There's no doubt. Trays are used adjunctively, but this is the best home care process out there. And if your patients do it, It'll give them not just healthy gums, fresh breath, whiter teeth, all these things that people want.
Well, and it helps you add a little bit to what your
Yeah.
narrative or your dialogue going
Right.
forward. And I think patients are going to want to see that. I think they're, again, my feeling is their view of the dentist patient relationship, again, where you're sticking your hand in their mouth and they're coming behind somebody else, and there's 10 people a day, there are going to be questions in their mind that they didn't have 6 months ago. So
Right.
when
Yeah.
you're out in front of that and they feel, okay, well, doc, it's less about, my cleaning went great, oh gosh, I still need that crown, to a bigger, broader conversation that's about your health. I think that's what they want to hear when they come in.
Right.
And I mean, you agree with that? Is that the kind of thing that you see? I mean, you see how your business changes after this?
Right. And you know what's been really interesting through this, in my opinion, I think the coronavirus has really, people are hungry for information.
Mm-hmm.
They've always gone to the internet, but people are hungry for the data. They want to know, how do I protect myself? And when I went to the dentist office before, I never worried about, is it safe, ever.
Right.
Right. Now, never worried about, is it safe? I just went. And so I might need a little reassurance as a patient, right? Is it safe? But then also to tie that into general immunity and your wellness it's not that hard. It's just shifting of a mindset and putting your systems in place so you can do it.
Well, and you guys, as I said before, you do it well. You're kind of the pioneer. So anybody who's watching or listening, how would they get in touch with you? We know where to get sort of the clinical parts of Perio Protect, but if they just, wanted general information, how would they get in touch with you guys?
The easiest way to get in touch with us via email is support@perioprotect.com.
Okay.
And if you ask for me, Tanya, I'll respond to you personally.
Okay.
You could also call 314-256-0772.
And I'll put that in the link.
Okay. And I can give you I'll give you my email address. You're welcome to give out my personal work email address if you want to put it in the link.
Okay. And that's, is that Tanya at?
It's T. Dunlap at Perio-Protect. It's not easy. That's why I didn't say it first.
Okay. We'll do that. I'll include that. And so one of the things I know about you is I'm a big picture, executive summary, bullet points guy. And Tanya, you are I love to watch you. There are times I find myself just getting drawn into. I've seen you do several presentations. Like, you guys know your stuff. This isn't just something you invented, and slapped together. You have a lot of detail and a lot of research behind everything you do, which I think connects well with the dental audience, especially right now.
We want to make accurate claims, and we want it to be practically effective for your practice. It's got to be, it's interesting. It's interesting, right? We like the bugs, we like the science, but you need some practical application. Well,
and you guys, you do that very well. So I know you are slammed right now, but I appreciate you taking the time to come on. And as I said, this is a little more in the strike zone of somebody who spent 4 years in dental school and now has to, talk to accountants and bankers and people they don't really want to or care to. So I think this is very helpful. Plus, it still fits within coming back stronger. Right. It's something that you can take the time to learn now that helps you address a new patient demand. So I really appreciate you coming on today.
Thank you so much, Steve.
So practice owners, again, Perio Protect, Tanya Dunlap. Thank you, Tanya. Please feel free to reach out. We will put the links in the notes below. If you forget that, you can always reach out to us at the Profitable Dentist, and we'll make sure you get connected up with Tanya. But until next time, practice owners, hang in there and do. Right now is a great time. You have a gift of time to do all the things to help you come back stronger. So with that, see you till next time.
Bye-bye.
Bye-bye.